Greetings. Are you a woman trying to conceive? Have you gone for your AMH test to check your number of egg left? Are you a woman trying to conceive? Have you gone for AMH blood test to check whether your ovaries is still producing egg or whether you have egg left in you? If no, or if yes, watch this video. Before I continue, please, I want to plead with you to please subscribe to my YouTube channel using the link in my bio. The name of my YouTube channel is Nigerian Health TV. Now, AMH means anti-mullerian hormone. It's a form of test done for women, especially women that are trying to conceive. You have been trying to conceive, whether you have been successful or you have not been successful. It is important for you to know your AMH because this is what AMH does for you. One, it will help check how much egg you have left in your ovary. Two, it will help check whether your ovaries is still even producing enough eggs. Whether your ovaries still have eggs left to make a baby. That's what I mean. Three, it will help check whether the eggs your ovaries are producing, whether they are viable, whether they are healthy enough to make a baby. So these are the three functions. AMH is also found in men, but it is more useful in women. Now, these are the values of AMH. These are the values of AMH. 1. For values between 1 to 3, it is normal. There are some women, values between 1 to 3, that AMH is normal. Then, this value is found mainly among women that are in their 20s, between 20 to 30 years. When you check their AMH, is between 1 to 3 is normal. Then there are a group of women whose AMH is below 1. Then that means the number of eggs left in you is low. Then there is another group of women, and this group of women that have AMH below 1, most of them are in their 40s. It's understandable. As you grow older, the number of eggs left in your ovary reduces, right? Now, there is another group of women that have AMH that is less than, that is around 0.4. In this group of women, they have no egg. It is assumed that they have no eggs left. And even when they have eggs left, the eggs are no longer viable. Let me say it again. The value is between 1 to 3, which is normal. Anything less than 1 is what do I call it now? Anything less than 1 is low. Then there are some people whose value is around 0.4. That value is 0. That means you have no eggs left in you. Now, how do you go about doing your AMH? It's just a blood test. You go to the lab and do it. And it is very important. Another importance of AMH test is it is used to know whether you will respond to fertility drugs like Clomid, letrozole, metformin. For example, it is a woman that still have eggs left in her that can be given all this medication to help stimulate ovulation, right? Because if there is no egg, there will be no ovulation, right? So, if you go to any of these your IVF center, any of these your fertility centers, what they will do first is they will check your AMH. Once they check your AMH and say, okay, your egg reserve is still good, then they can start you on fertility drugs so that you can release egg for baby to be formed. But if they realize that your AMH is low, very low, or you have no egg, they will advise you to get an egg donor, right? You understand what I mean? So sometimes when you hear they say you should get an egg donor, it's because they've checked your AMH and they realize that you don't have any egg. I'm not trying to say this in any mocking manner. I'm just being direct and I'll have to tell you the truth. So anytime you go to your fertility doctor, ask them about AMH and even show them this video that I have one doctor online that said you should check my AMH before we go ahead with this fertility treatment. And they will oblige. They'll say, okay, they will check your AMH. So AMH has this importance. 1, it helps to check the reserve of your ovaries. 2, it can be used to know how much eggs you have left, your egg count. 3, it can be used to know whether the eggs you have left are healthy to make a baby. And 4, it can also be used to know whether you will respond to fertility treatment. Go and check your AMH, especially if you are in your 40s, you are in your late 30s, you are in your 40s. AMH test is a test that you must do. It's a test that you must do. It's not negotiable. You must do it so that you know your egg count. Because as you age, your AMH level, your egg count reduces and your AMH level reduces. So you cannot be in your 40s and you go and do AMH and you are seeing a value of 3, that one most likely that is something like an aberration. It's not that it cannot happen, but it's very rare because your egg count has dropped. You cannot be in your 40s and expect to have the same number of eggs as somebody that just started menstruating, that is in that is 19 years, 20 years, even 25 years. I hope you understand what I'm trying to say. AMH is a key part of fertility treatment, and AMH test is a key part of fertility treatment. It's a key part of IVF or whatever test, fertility test you are trying to do, or fertility treatment you are trying to undergo. I want to end this video here. If you have any question, put in the comment section. I will answer you. I want to plead with you again to please subscribe to my YouTube channel using the link in my bio. The name of my YouTube channel is Nigerian Health TV. It's right on your screen. And I want to thank those people, especially people in the diaspora, that have been sending me coins on TikTok. I never knew you can send people coins on TikTok. I never knew until recently. People have been sending me coins, and they've been somebody even sent me rolls, some sent me I don't know, they have different names. Some is 20 coins, somebody sent me 50 coins, I don't know, 15 coins and the rest. They said they want to use it to support my content creation, because I've been wonderful. I don't know how true that is. I want to thank you all. I really appreciate. I never knew that you can send me coin to support my ministry. You are gradually moving this ministry, this doctor ministry, to a permanent site. I really appreciate you. Please, as you are sending coins, also don't forget to subscribe to my YouTube channel. I thank you very much. I thank you very much. One of these days I'll go live. I'll go live so that I can answer all your questions, right? I thank you very much for your support so far. It has been, I don't know how to really thank you. I appreciate you. For people that have been meeting me, talking to me on the DM, I also thank you. Bye-bye.